Hello and welcome to YouTube channel HealthQ, the place where our mission is not only to motivate you, but help you to go on to the practice side of health. I'm your host, physiotherapist Muthanlur. In this video, I am going to explain you how physiotherapists can help you when you are suffering from stroke, or else someone of your loved one is going through the stroke. But before we start, we should definitely understand what exactly is stroke. So let me explain you that first, and then I will explain you what are the step-by-step process that we as physiotherapists do when we are treating someone who is suffering from stroke. Let's get started. Friends, stroke is a neurological disorder. In this condition, what happens is there is damage to the brain cells. The damage to the brain cells happens due to two major reasons. Number one type is called as ischemic stroke, which means that the blood supply was stopped in the certain parts of the brain due to a plaque or is a obstruction that can happen in the blood circulation of the brain. Especially this happens in the arteries. Or else it could be a hemorrhagic stroke where there is rupture of a blood vessel. The common cerebral arteries, like middle cerebral arteries, anterior cerebral artery, posterior cerebral arteries, and many other arteries can go through this kind of stroke attack. And wherever there is this ischemia happening or wherever there is this hemorrhage happening, the blood supply will be obstructed or stopped for a certain period of time, due to which that area of the brain cells will undergo death. Or as you can see, there will be cell death or neuronal death, due to which that particular area of the brain functioning gets impaired or affected. And depending on that only, the symptoms of stroke would be seen. Majorly, whenever a person suffers from stroke, goes through something called as hemiplegia or as hemiparalysis, which means that one side of the body is paralyzed or as one side of the body gets weaker. Along with that, patient can also be in a state of coma or semi-coma for a few days due to the shock that the brain goes through, and slowly the patient recovers. Patient can even have an impairment in terms of their memory. So there could be a memory loss, there could be a speech loss, there could be loss of ability to swallow, there could be loss of ability to breathe in the normal way, and there could be loss of physical movements, all depending on what brain area was under damage. So that's what is stroke all about. Now, as I said, depending on what area of the body has been affected, the or unique part about stroke is that if your left side of the brain is affected, then your right side of the body will be affected. And if your right side of the brain is affected, your left side of the body will be affected. This happens due to the cross-structured supply of the brain to the body. Very similarly, a person suffering from stroke also go through facial paralysis. Yes, you got it right. Due to stroke, a person can get facial paralysis. That's very different condition from Bell's palsy, which is also a very common type of facial paralysis. The difference between this is that in stroke, 1/4 of the face will be paralyzed, whereas in Bell's palsy, entire 1/2 of the face is paralyzed. In stroke, there will be more muscle stiffness and lack of movement, whereas in facial paralysis or Bell's palsy, initially there is a complete paralysis. The eyes are not able to close, and there is no movement at all. Whereas in stroke, there are some movements that are gradually seen in a patient. So these are the certain symptoms that I spoke about. But more than that, what are the chronological ways on how slowly patient recovers from stroke? Let me talk about that as well. So whenever a person goes through stroke, this is a medical emergency, and that's why patient has to be admitted in hospital. Initially, patient could be in a state of coma or a semi-coma, but slowly patient will start recovering as the medicines will start working. If required, patient might go through a brain surgery as well. Depending on the loss, the recovery will also be there. As patient's vitals will start stabilizing, patient will observe movements coming back and improving. So initially the patient can be completely bedridden, but slowly there will be improvement in the movements. Movements will get better. Patient will develop ability to sit on themselves, stand on themselves, and even walk. And that's where they need help of physiotherapy. Because when the patient is going through this journey of complete paralysis to recovery, there are a lot of secondary problems that can also develop. For example, the major problem that a patient suffering from stroke develops is the pain and the damages to their muscles and the bones due to wrong way of holding. Since body is paralyzed, the patient has to be dependent on others for their transfers. So if a patient has to be transferred from one bed to a wheelchair, from wheelchair to a toilet, anyway, the patient needs support of somebody else. And if the person who is holding or carrying this patient is not using the right methods, definitely their muscles are going to be damaged. And due to that damage, they will develop some secondary issues. Apart from that, if a patient is bedridden for a very long period of time, they might develop something called as pressure sores or as ulcers over the skin. This also needs to be prevented and can be prevented with the help of transferring activities. That's not all. Patient develop a lot of pain in the structures of the body due to lack of movement. They develop lack of awareness of the movement in the body due to the nervous damage. At the same time, patient also forgets the right way of walking, the right way of speaking, the right way of moving. Why? Because the brain has damaged, right? And that's why to work on this, the brain requires retraining. The brain requires teaching again, or as you can say, re-education of the muscles back. Very similar to a child who learns or steps or new movements completely. And that's what is the role of physiotherapist. So, what does physiotherapist do when someone is suffering from stroke? So, role of physiotherapy starts exactly from the ICU and the patient is in bed state. Why? Because since the breathing muscles are not working well, they are at risk of developing cough, at the same time, phlegm in the chest muscles because chest muscles are not functioning. That's where postural drainage and chest physiotherapy helps in removing those extra fluids that gets accumulated in the chest muscles. At the same time, movements, passive movements of legs, of hands, helps to maintain the blood circulation, helps to maintain the muscle memory, helps to maintain the muscle flexibility. That's what is the role in the initial phase of this. That's what is the role of physiotherapy in the initial phase of stroke. As the patient gets better, his ability to move also gets better, and that's where physiotherapy also comes into the picture. Physiotherapy has to be very extensive at this stage because the more sooner we start, the more brain will be able to adapt those movements and will show recovery signs. That's where transport training, passive movement, physical exercises in the bed, breathing activity, proper transferring training are some of the key factors that has to be kept in mind when a physiotherapist works with a stroke patient in the initial phase. As the patient will improve, they will also observe there will be increased tightness, increased spasticity in this muscle. This will make the movements more and more difficult. And that's when, again, physiotherapy exercises play a crucial role. Gentle range of motion exercises, joint compression therapy are some methods that we as physios use in order to help a patient to develop tone control. At the same time, when the patient is in recovering stage, we focus more on functional activities. The idea is to make patient independent as much as possible. That's where we train patient to roll from one side to other side, to come from supine or sleeping position to sitting position, sit to stand activities, and also walking training. So we teach patients how to walk with the help of support. Now, here comes another factor. Since stroke is there, where there is a lot of muscular changes that has happened, muscles are not functioning the way they are supposed to. So patient develops wrong habits, wrong patterns of movement. This needs to be corrected initially. That's where postural training or gait training or right movement pattern training comes into the picture. Here, the focus of a therapist is to retrain the patient, teach the patient to use the right methods of movement. We use methods like mirror therapy here to show patient or give them the feedback. What is the right way of moving the hand? What is the right way of moving the leg? We also use methods like PNF, which is called as proprioceptive neuromuscular facilitation technique, where physiotherapist uses their own commands, their own hands to show the patient the right movement patterns. At the same time, we take help of some external devices like belts, crutches, orthotic devices to maintain the joints in the right position. Because what happens is when patients don't have the movement control, they tend to move wrong movements and they tend to develop wrong patterns and lead to muscle injury. That's where additional support is required, and that support is given with here. So, in this entire process, there was one important concept that was always kept in center, and that is what is neuroplasticity. Neuroplasticity is a concept which believes that the brain has the ability to reorganize itself. So, if one area of the brain is damaged, that's okay. The other brain areas, which are absolutely normal, can take over the task of the damaged area and help an individual to attain maximum movements, maximum functions. And that's what is the role of physiotherapy. That's not all. There are many other rehabilitation professionals who are also involved with working with stroke patients. These professionals would be speech therapists, occupational therapists, orthotics, etc. So we have to always remember that stroke rehabilitation or management is a team approach. Your family member or caregiver also plays an equally crucial role, as important as a physiotherapist or doctor or any other therapist plays. So it's important that we all come together to make sure that we help a stroke survivor or as a patient or someone who is suffering from stroke. So friends, through this video, my attempt was to help you understand in a very short manner what exactly a physiotherapist do when working with a stroke patient. I hope you found this video helpful and informative. So do share it with someone who might need it.